Chronic inflammation is behind almost every major disease of aging. Here's how to know if it's silently damaging you right now. Scientists have a name for the low-grade, persistent inflammation that accumulates with age: inflammaging. It drives heart disease, Alzheimer's, type 2 diabetes, arthritis, and cancer. It's not the acute inflammation you feel when you twist an ankle; that kind heals and resolves. Chronic inflammation is quiet, constant, and destructive. The good news: there are 6 signs you can check today. And if they apply to you, the protocol to reverse it is straightforward. Sign 1 is one you probably already know if you have it: persistent joint stiffness or pain that isn't explained by injury. When inflammation is systemic, it concentrates in joints. This shows up as morning stiffness that lasts more than 30 minutes, aching in the fingers, knees, or hips without an obvious cause, and pain that seems to migrate or fluctuate. This is different from osteoarthritis, which is mechanical wear. Inflammatory joint pain tends to feel worse after inactivity and improve with gentle movement. Biomarkers like CRP, C-reactive protein, and ESR, erythrocyte sedimentation rate, are blood tests that can confirm systemic inflammation. Sign 2 is brain fog, difficulty concentrating, slow thinking, or memory lapses that seem unrelated to sleep or stress. Neuroinflammation, inflammation in the brain, is now recognized as a central driver of cognitive decline. Research from the Journal of Neuroinflammation found that elevated inflammatory markers, specifically IL-6 and CRP, were strongly associated with accelerated cognitive decline in adults over 65. The blood-brain barrier, which protects the brain from systemic inflammation, becomes less effective with age. When peripheral inflammation is high, inflammatory cytokines can cross into the brain and impair neuronal function. Brain fog that comes and goes, especially in relation to what you eat or how much you sleep, is a common signal. Sign 3 is stubborn belly fat, visceral fat, the kind that accumulates deep around your organs. Visceral fat is not inert. It is metabolically active and functions essentially as an endocrine organ. It secretes inflammatory cytokines, including TNF-alpha, IL-6, and resistin, that drive systemic inflammation throughout the body. This creates a feedback loop: inflammation promotes fat storage, and fat storage promotes more inflammation. Breaking this cycle requires both dietary and movement interventions, not just calorie restriction. A waist circumference above 35 inches for women or 40 inches for men is a clinical indicator of high visceral fat and elevated inflammatory risk. Sign 4 is getting sick more often than you used to, or finding that cuts, bruises, or minor injuries take longer to heal. Chronic low-grade inflammation paradoxically suppresses immune function. Your immune system has 2 modes: acute response, fighting pathogens, and chronic maintenance. When it's stuck in constant low-level activation from systemic inflammation, it becomes less effective at mounting rapid responses to new threats. If you find you pick up every cold that goes around, or that a small cut takes twice as long to heal as it used to, elevated baseline inflammation is a likely contributor. Sign 5 is persistent fatigue that sleep doesn't fix, different from tiredness. This is a heavy, systemic exhaustion. Inflammatory cytokines directly signal the brain to conserve energy. This is the sickness behavior you feel when you have the flu, just at a lower volume and on a permanent basis. Studies have found that elevated CRP and IL-6 are strongly correlated with fatigue scores in adults over 60, independent of depression or sleep disorders. If you're sleeping adequately but waking up exhausted, chronic inflammation may be the underlying driver. Sign 6 is one most people don't associate with systemic health: periodontal, gum disease. Gum disease and chronic systemic inflammation share a bidirectional relationship. Oral bacteria from inflamed gums enter the bloodstream and elevate inflammatory markers throughout the body. Conversely, high systemic inflammation makes gum disease worse. Research published in the Journal of the American Medical Association found that people with severe periodontal disease had 50% higher CRP levels than those with healthy gums. Treating gum disease actually lowered CRP by up to 20% in randomized trials. If your gums bleed when you brush, or you've had periodontal disease flagged by your dentist, treat this seriously as a systemic issue, not just a dental one. Here's the evidence-based protocol for reducing chronic inflammation. Diet is the foundation. The Mediterranean diet consistently shows the strongest anti-inflammatory evidence, emphasizing olive oil, fatty fish, colorful vegetables, legumes, and nuts, while minimizing refined carbohydrates, seed oils, and processed meat. Targeted supplements with solid evidence: curcumin, Esmeriva or BCM95 for bioavailability, at 500 to 1000 mg daily, omega-3 fatty acids at 2 to 3 grams per day, EPA plus DHA, and vitamin D3 if you're deficient. Movement matters. 150 minutes of moderate aerobic exercise per week consistently lowers CRP and IL-6. Sleep is anti-inflammatory. Less than 6 hours per night raises inflammatory markers significantly. Prioritize 7 to 8 hours. If 3 or more of these signs apply to you, chronic inflammation is likely a factor in how you feel. The good news is it's measurable. Get a high-sensitivity CRP test and it's reversible. Subscribe for more evidence-based health content for adults over 50. And drop a comment. How many of these signs do you recognize in yourself?